Hello, this is Howard Owens, publisher of the Batavian, with another live stream interview. This time we're talking to Tim Yaeger, Emergency Management Coordinator, and we're going to find out kind of what his role, his department's role is in the coronavirus pandemic and how it affects Genesee County, and just get his views on a few of the things that affect us. So, Tim, there you are. How you doing? Good to see you.
I'm good. Good to see you, Howard.
Good. So first of all, maybe just fill us in on emergency management's role, emergency services role in a pandemic situation like this. What function do you play?
It's obviously a unique role, I think, from what we normally deal with day in and day out with typical emergencies throughout the county. This is obviously a health-related event, so we take a lot of direction and collaboration with the health department of the county and with the state and through CDC. But it really still hits the same elements of emergency management that we deal with on a day in and day out basis, and that's response and preparedness, mitigation, and recovery. So in this point, we're doing a lot of planning as we move forward to what we may see coming down the line with the spread. We're doing a lot of mitigating factors, trying to communicate, trying to keep all the partners, state, federal, local partners, communicating well, communicating with the first responders, healthcare agencies, hospital, a lot of laundry list of folks that we communicate with, getting commodities in, resources, ordering through the state, ordering through the county, whatever vendors that we can find available, we're going to utilize. So number of things. The response side of this right now is good to the fact that our normal everyday law enforcement, EMS, and fire responses are significantly lower because people are staying off the roads, people are at home, practicing social distancing as they should. So we're not seeing the activity level of normal emergency operations that we would typically see, on a day in Genesee County.
I think for a lot of people that have a very cursory knowledge of your job, or what your department does, we the most public face kind of emergency management is working with the fire departments and the fire training and being at fire scenes and accident scenes. This part of your job is not as prevalent, is not something we see all the time. But this is the kind of thing you prepare and train for all the time, right? I mean, this is a big part of what you have to be ready for.
It is, absolutely. There's obviously the larger counties have separate, divisions or departments that can handle emergency management. Most of the smaller rural counties, such as Genesee, we cover all those elements. So we're doing the fire safety, the EMS, hazmat, tech rescue, those elements, as well as emergency management. And emergency management is behind the scene. We regularly open our emergency operations center here in Genesee County, again, typically storm related. This has been open for over 30 days now just because of this event. So the things that we're doing, obviously, is a lot of planning and preparing, and a lot of those things really have to do with building relationships with all the partners that we would deal with. And we are now dealing with folks that we wouldn't think that we would ever have to deal with in the past. But every health organization that you can think of, both at the state level and the local level that we deal with now, and mostly, obviously, they're reaching out to us for PPE needs and trying to orchestrate that into a good process so they're comfortable and we're comfortable to fulfill their needs on a daily basis. The other things that we're doing is a lot of the planning that we've always done, and now we're enacting some of those plans. A lot of the training and the programs that we go to are to be familiar with how to deal with these large-scale disasters. In this case, this is something that this county has never seen to this level. We hope we never do see it again, but we're prepared to deal with it. Everyone is working well together, whether it be government officials from the county level to the state level to the local level. All the first responders are being extremely cooperative. A lot of guidance that's been given out to them, things that we normally haven't had to do in the past, we're doing. And we're going to continue to do those things and flex as the situation develops.
One other thing that occurs to me is, in a part of emergency planning, hopefully we're going to, flatten the curve, so to speak, that we'll be able to keep things under control here. But you also have to plan, I assume, for a kind of a worst case scenario, and I imagine you're involved in logistics, helping UMMC or whatever just talk about what your role would be if things, for lack of a better term, get out of hand.
Well, we're going to do everything we can to keep it from getting out of hand.
Yeah.
And again, to stress the fact that we want people to adhere to what our health department, what the state health department, what the CDC is asking everyone to do. This is the most concerning event in my 32-year career in public safety. There's not many things that I think would bother me to the fact of any emergency that we have. They're all controllable, and there's always a beginning and an ending. We apply good strategies and tactics, and we find that some are less fortunate endings than others, but we come to a conclusion that we don't know when it is. Days, weeks, we're hopefully not months. Is difficult to deal with. With the hospital itself, particularly, again, working with Dan Ireland and his crew, he's got a good handle on what they're doing. We're working with them to make sure primarily that their personal protective equipment is supplied to the level that they're comfortable and we're comfortable with. And then we are looking at ways to expand their capability, as they've been asked to do by the New York State. And some of those things are bringing in some resources, some beds, and possibly some other equipment that we can provide to them. We brought some equipment in already for their surge of their ED, emergency department, and now bringing in some supplies so they can expand the hospital campuses, both North Street and Bank Street. Beyond that, we are looking at an off-site location that we may have to expand to as well. We're hoping that we don't get to that point, but we're preparing for that. We're always preparing for the worst and praying for the best. And but we've been working for the last 2 weeks to have an off-site facility that would be suitable to put non-COVID patients there to recover. So we're going to continue to work on that.
So I wanted to talk to you about the supply issue, the PPE issue. One thing that I don't know, surprised might be the wrong word, but when as I was watching memos go back and forth and what in your discussion now, I kind of expect you would deal with PPE, say, for the fire services, but you're also dealing with it for the hospital itself, it sounds like. And so talk about your role in PPE for the county and how that supply chain is going right now.
Well, it's very unique. I mean, we're supplying all the way down to pharmacies, so nursing homes, skilled nursing facilities. So anything that has to do with healthcare, we're being asked to supply that PPE on a daily basis. So we've been asked, we had supplies in hand in the county between the health department and what OEM had in-house, and then we're being augmenting that by state supplies and as well as some supply chains that we're purchasing from vendors. We have a burn rate, so we're looking at what are those agencies using per day, per week, and then we have to adjust our inventory based on what their burn rates are. I will tell you, we don't have the PPE in the county to the level that I would want it to have. There's some facilities that are asking for certain items that we just don't have. There's certain items that they would like to have more of. We just don't have those items. So it's extremely concerning. We just got off a call this afternoon with New York State. And so far, there's no shipments coming into Genesee County. We do have every healthcare agency supplied to the level that, the best to our ability, have them supplied with PPE. And we do have a small amount of reserve here within the office to be able to resupply them as the activity grows.
It sounds like what you're saying is that you're at an amount that's concerning, but you're not at a critical stage right now.
That's accurate.
Okay. So there's been a lot of talk about the governor's order, and I know for the general public the main concern has been ventilators in the hospital and what he might do or not do regarding that, and the National Guard and everything. But the executive order also covers PPE, and it sounds like you don't have enough. What's the communication to you from the state regarding that executive order and what you can expect?
Silence, I guess, is what we're hearing right now. There are some items that we're asking for, generators and some other things that we have asked for, and the state has been able to supply that. And again, we can't be any more than the state can't be fully dependent on the federal government. Every county cannot be completely reliant on New York State to supply some of these things. Counties have to resource their own equipment, their own items, and that's what we're doing. We're going to continue to do that. Every good first responder, emergency manager is going to have a plan A, a plan B, and a plan C, and that's what we're enacting. If plan A doesn't work, we better have a plan B that we can engage. And if that doesn't work, we have a plan C to engage. So that's how we're taking our business profile forward, is to be preparing for every time something doesn't come through, that we hopefully have another alternative that we can deploy.
It sounds like you're not surprised, or not. It's how you would expect it to work, that the state doesn't rely on the federal and the county doesn't rely on the county. I mean, that the system is complex, right?
It's a complex system. I think it's just, I don't think any country, there's no way FEMA is going to be able to have the stockpile of this magnitude, and that's pretty evident, and the state's not going to have the stockpile to the magnitude, nor is a county. So I wouldn't say I'm not surprised by it. I don't think anybody should be surprised that these things, especially the PPE, is in short supply. That's why we are enacting some CDC guidance, what they basically call under a crisis mode, of how you need to reuse. Now, I wouldn't say reuse, but be very deliberate in how you're using PPE. For example, some goggles, safety glasses, eye shields. Those things can be sanitized, disinfected, and reused again. Some of those things may be used once and throw away. We don't have that luxury to do that, so we have to be very, very diligent and very, very careful of how we use our PPE, who it's issued to, and make sure that the usage of that PPE is appropriate for that application. Everybody, it would be great if everybody could have an N95, but it's just not a practical way to look at these things. We really want to keep folks, if they want to wear masks, obviously a mask keeps things internal, N95 keeps things external. So if people want to wear them, I think that's a good thing. I've been out and about in the town, and I think for the most part, the vast majority of the community is adhering to the guidance that the health department is providing and we're providing. And unfortunately, those people that are adhering to that guidance have to keep hearing, it's kind of that shotgun approach. They keep hearing us reinforce our message, because there's still a majority or a minority of the population that is not taking this serious for whatever reason. And all they're going to do is prolong this situation, and they don't understand the devastating effects that it has, and they may be, feel that they're a very young, energetic person, but it's really not that person. That we don't want that person infected. We obviously don't want the elderly folks infected, but we don't want anybody infected, because it's going to spread. And it's hard because it's an unseen threat, right? You can't see it, you can't feel it, you can't taste it. If somebody has a weapon, you see a threat, you know to move away from it. In this case, it's invisible, so it's hard to get that through, I think, many people's minds. But I see the cooperation by the vast majority of the community, and we thank everyone for doing that. So we're just going to keep moving forward with that same message, and hopefully things improve.
Before we got on the call, I had to run to BJ's, and just your talk reminds me of a couple of thoughts. One is I wore a homemade mask, and it's hard not to feel a little foolish doing that. You're not used to being out in public that way, and I understand that other people may not be comfortable doing that, and you just kind of have to decide what you're talking about. This is an unseen thing. You really don't know kind of where the enemy is, so to speak, and it's better to be prepared, and you never know if you're infected. That's the main reason you want to wear a mask out in public. And then the other thing, I was a little concerned at how few people, I think say only about a third of the customers in BJ's were wearing masks, and a couple of people seem to be really lax about the social distancing. And so I'm still a little concerned that the message isn't necessarily getting through. It's something that we're going to continue to keep pushing. That's why we put out the alert message on the phones the other day. I had more positive comments back of people that may have not received it. And we are working with the federal government with IPAWS to find out. And there's some reasons. It's mostly technical, data related, and
phone software version related issues of why some people may not be receiving those messages. They're aware of it. They're working on that. But by the vast majority of the people ask me, why didn't I, my wife received it, but why didn't I receive that message then? But I think it is a public health emergency. It's not an emergency of a tornado or, a weather event, but it is a public health emergency. And that's why we felt, the county felt, the health department felt it was prudent to use that system. And we'll continue to use that system if there's other immediate information that the citizens of Genesee County need to get as quickly as possible. We're gonna re-engage that system.
I got my alert yesterday, and I think a couple of minutes after that, I saw somebody posting on Facebook wondering why they didn't get their alert. So I think that shows good awareness.
Yeah, I mean it's cooperative. People want to know what's going on, and that's part of our job too, is emergency management. We need to be able to communicate with the community. We need to communicate to the fact that everybody here is working as hard as they possibly can. We have a small staff here of 4 people, augmented by part-time people and per diem people that come in. They're doing a fantastic job. We're working 7 days a week, long hours, working with all our public safety partners, working with our health department partners, working with all the health community partners to do the very best we can to combat this. We appreciate the media's coverage. That's important too, to continue to communicate to the public that we're going to get through this, but everybody has to work with us to get to that point. Huge level of cooperation, and I think again, many people are. It only takes those few in the minority that ignore the warning signs, ignore the magnitude and the scope of this issue, and that's really just going to prolong this, and inevitably can cause deaths. And that's our other mission, is obviously to prevent any deaths in our community, and we're going to keep working hard to see what we can do to make sure that ends.
Shifting gears just a little bit, you still have a big responsibility, big role to play in, responses to fires and accidents and that sort of thing, and what the fire departments do, particularly among the volunteers. So I wanted to talk about readiness, and it's kind of a multi-parted thing. I imagine with social distancing, training is cut back, if you can even do that. That, as you mentioned earlier, there are not as many cars on the roads, not as many accidents. There's not as many incidents happening, and sometimes those minor incidents kind of act as training too, and help prepare people for responding. And then also you have other things on your plate right now that you might have to shift focus if something came up. So I just wanted to get the scope of how you think readiness is being maintained.
The fire service, law enforcement, EMS folks, they're all trained. We train just to hone our skills, refresh our skills. Obviously, new members coming in, that training never ends. We're always prepared to respond to those emergencies. This is a little bit different. There are some things that the fire departments are doing on backing off on some of their meetings that they would normally have. They're not having those meetings. I know there's some fire companies doing some online meetings, some online training. Or if they are holding some training, they're abiding by the governance that they've been given to, socially distance themselves, sanitize the fire station. So we need to maintain public safety. So, they're there making sure that fire station is a safe place for their members to be, and making sure that their equipment is ready to go. So those things are not being jeopardized. I think you had asked about at one point about the age of some of our first responders in the volunteer ranks. That is a concern. The fire chiefs are aware of that, and I know many of those conversations have occurred individually within their fire company of some folks that are up in age probably shouldn't be responding, or they can respond, but they need to stay at the road. They're staying distance away from those residences, and that's just the best protective measure that they can take. But we're continuing to respond, continuing to train. We've got some of the best, first responders around this region. They're dedicated to keep doing the job, and they're going to continue to do that. So nobody's at risk. If there's an event that we start to see some of the first responders get infected or they get ill, then we'll make sure that we make arrangements, and every public safety agency within Genesee County has been asked to come up with contingency plans in case they do start to see some declining availability of their staffing. So we have plans in place for law enforcement, we have plans in place for corrections, and plans in place for fire and EMS to have those systems augmented other ways, and we'll still get the job done.
That's really good to hear. Tim, I think we've hit on everything that I thought about ahead of time to talk about. Is there anything else you wanted to mention or talk about?
Yeah, I think, the other thing that as we look through this, that typically, if we have storms, we may have some areas that are impassable due to, wires down or snow in the roadway. So we're always looking for the elderly, the folks that are vulnerable, to be able to get to them, to make sure that they're cared for, they're okay, they've got the sufficient food and medicine and things like that. This is a different situation. We're telling people purposely to stay home. Take care of themselves, but take care of their neighbors, take care of their loved ones. Please check in on them. Find out if they've got the medications. Find out if they've got sufficient food sources. A lot of the pantries, a lot of the community groups and church groups, faith-based organizations are doing a fantastic job feeding those folks that are out of work. I see a lot of things going on as far as donations, as far as restaurants. And if you're employed, if you have a job and you've got some money, donate to the Salvation Army. Donate to the Food Link, donate to the Community Action, donate to your local food pantry. Plenty of opportunities to help out, and that's what we need right now, is everybody to come together and to help those less fortunate, because there's a lot of families out there that need food and may not have transportation to get to some of the things that these churches and the Salvation Army is doing, or some of your local food pantries. So please reach out to your loved ones, find out, make sure they're okay, make sure they've got the medicines that they need, and it's going to go a long way to making sure that everybody gets through this safe and healthy.
Well, Tim, it sounds like you've really thought all this through, and that you've got a good plan in place and are taken care of as well. I think everybody appreciates that. I know how seriously you take public safety. You're always concerned about everybody's safety around, including mine, has come up before, so I appreciate that. And thank you again. Thank you for your time. I know you're very busy. Again, any final thoughts before we sign off?
No, just want everybody to be safe, and we'll get through this together. Absolutely. Appreciate it. Thanks, Howard.
Great. Thank you very much.
Take care.
So everybody, Howard Owens with Batavian. We've been talking with Tim Yaeger, Genesee County Emergency Management Coordinator. Really appreciate his time getting on a call with us. And stay tuned for more news. We'll talk to you later.